Hello, my name is Dr. Dewan S. Raja. Today I will solve multiple choice questions in the upper limb anatomy from question number 31 to 40. As usual, I will put the answer key as well as two of my book in the description of this video for your kind information. Let us solve the questions. Question number 31. Which of the nerve, what is the nerve supply of the indicated muscle? What is the indicated muscle? This is the indicated muscle. What is this nerve supply? Suprascapular nerve, upper subscapular nerve, lower subscapular nerve, axillary nerve, dorsal scapular nerve. What is the muscle? Muscle is the teres minor muscle. What is this nerve supply? Nerve supply is the axillary nerve. Okay, suprascapular nerve supplies supraspinatus, infraspinatus. Upper and lower subscapular nerve supplies the subscapularis. Lower subscapular nerve supplies the teres major. Axillary nerve supplies the teres minor. And dorsal scapular nerve supplies the rhomboid major, rhomboid minor, and partly the levator scapulae. So here we'll get the dorsal scapular nerve. Our answer should be this. The teres minor nerve supply should be the axillary nerve. Okay, that is the answer. D is the answer. Okay, you got that? Now go to the second question, number 32. What is the nerve supply of the muscle inserted on the indicated area? This is the indicated area. This is the radius. Okay, this is the radius here. Okay, this is the indicated area here. Okay, on the posterior aspect, this is the anterior aspect. This is the posterior aspect. Okay, of my bone here. Okay, so if you go there, okay, here is the bone here. We're getting that. This is the bone. Okay, here is the anterior surface. This is the posterior surface, and this is the radial tuberosity. This is the posterior aspect. What is the muscle? We'll find out that. So this is the bone. This is the site of insertion. This is the posterior aspect of the dorsal tubercle. Anterior aspect smooth here. Okay, so this is my bone. This is the left radial bone. Okay, so here the insertion. Okay, we'll go through that part. Let us get that. Okay, here is different. This is the right bone. The right bone is here, right radial bone. In my hand is the left radial bone. Okay, we got that. And nerve supply, what muscle inserts here? The biceps brachii muscle. So the nerve supply of the biceps brachii. Nerve supply of the biceps brachii is the musculocutaneous nerve. That is the answer. E is the answer. So E is the answer. That is the biceps brachii insertion here. Nerve supplied by the musculocutaneous nerve. Okay, we got that. Now to the next question. Question number 33. Which of the following is a plane type of synovial joint? Plane articular surfaces. Where it is? Sternoclavicular joint, acromioclavicular joint, glenohumeral joint, elbow joint. Okay, sternoclavicular joint is a saddle type synovial joint. Glenohumeral joint, this is a ball and socket type of synovial joint. Elbow joint is a hinge variety of synovial joint. So this is the acromioclavicular joint, which is a plane type of synovial joint. Answer is B. Okay, we got that. Now go to the fourth question. The highlighted nerve is a continuation of what? This is the nerve. Okay, this is a cutaneous nerve. It is a continuation of which nerve? Radial nerve, ulnar nerve, musculocutaneous nerve, median nerve, axillary nerve. This is the lateral cutaneous nerve of forearm. This is a continuation of the musculocutaneous nerve. This is the answer. Okay, so this is the lateral cutaneous nerve of forearm. root value C5, C6. It is a continuation of the musculocutaneous nerve. Answer is C. Okay, number 34. Then we'll go to question number 35. Which of the following nerve is transmitted through the highlighted neurovascular tract? This is the quadrangular space. Okay, what nerve is transmitted through it? That is the, what is the nerve? Suprascapular nerve, dorsal scapular nerve, radial nerve, axillary nerve, ulnar nerve. Answer should be the axillary nerve. D is the answer. D. Okay, we got that. Now question number 36. The indicated nerve is derived from which of the following part of the brachial plexus? This is the nerve. Okay, what is this nerve? This is a nerve passing out, transmitted through the quadrangular space, supplying what muscle? The deltoid muscle and also the teres minor muscle. What is the nerve? The axillary nerve. Axillary nerve coming out of which part of brachial plexus? From where? Posterior cord, medial cord, lateral cord, upper trunk, roots. Answer should be from the posterior cord. This is the answer. Okay, now go to the next question. Okay, which of the following artery is transmitted through the highlighted neurovascular tract? This is the neurovascular tract here. What is this? This is the upper triangular space, or we can call it just triangular space. This is called lower triangular space or triangular interval. This is the upper triangular space. What is the content here? A blood vessel. What is that blood vessel? Suprascapular artery, dorsal scapular artery, profunda brachii artery, posterior circumflex femoral artery, circumflex scapular artery. Answer should be circumflex scapular artery. This is the circumflex scapular artery. That is the answer. C is the answer. This is from the triangular space. We can call upper triangular space, lower triangular space, or just triangular space. This is also called triangular interval. Okay, so answer should be circumflex scapular artery. We got that. Now we'll go, which of the following nerve is transmitted through the highlighted neurovascular tract? This is the triangular interval or lower triangular space. What is the content of the lower triangular space or triangular interval? Suprascapular artery, dorsal scapular, suprascapular nerve, dorsal scapular nerve, radial nerve, axillary nerve, median nerve. Okay, answer should be the what is the nerve? Radial nerve. This is the answer. This is the basis for the radial nerve. And what artery? Profunda brachii artery or deep artery of the arm, plus the radial nerve. So our answer should be the radial nerve. Okay, we got 38. Now go to the 39. What is the nerve supply of the indicated tendon? Okay, nerve supply of tendon is like that of the muscle. So what is this muscle? This is the triceps muscle. What is this nerve supply? Median nerve, ulnar nerve, radial nerve, musculocutaneous nerve, axillary nerve. What is the answer? Answer should be what? Radial nerve. Answer is the C here. Okay, we got that. Number 40. Okay, we'll correct that. This should be 40. Okay, this is 40 here. Okay, write it 40. Okay, 40. Okay, so what is the question number 40? A 6-year-old girl was lifted by the wrist by her mother to cross a road. The child cried out, refused to use the limb, protected the limb by holding it with the elbow flexed and the forearm pronated. The emergency room physician had diagnosed the case as pulled elbow, also called nursemaid's elbow. What happened with subluxation of the radial head? That is the diagnosis of the physician. This was caused by tear or loosening of which of the following structure? Okay, so this is pulled elbow with subluxation of the radial head. This was caused by tear or loosening of which of the following structure: ulnar collateral ligament, radial collateral ligament, annular ligament, we can call annular ligament, or annular ligament of the radius, bicipital aponeurosis, interosseous membrane. So question number 40, what would be the answer? Answer should be what? The annular ligament or annular ligament of the radius. Okay, so due to pull, the radial head come out. Okay, so that is the situation here. It is easily manipulation without surgery by the physician, so that the radial head may go back to its position. Okay, so our answer is the C. That is the annular ligament of the radius. Okay, we got that. Okay, so that's all about the multiple choice question from 31 to 40. If you have any question, please feel free to ask me. Okay, please, this is 40. Okay, so please feel free to ask me and share the information with your friends, and please look at the answer key, and if you are interested, you may collect my books. What I have put the Amazon link in the description of the video. So have a nice and wonderful day. Bye now. Thank you.